Okay, well, good morning to everyone who has just joined, and thank you for joining this Growing Multinationals digital coffee event. My name is Suzanne Galbraith, and I lead the network across the European region. I know most of you already, but I know that today we do have some new members that are participating. Welcome. Just before we start, I wanted to give a quick background on the Aon Multinationals network. We established this group at Aon last year to connect EMEA, regional, global HR, reward, benefits and insurance professionals who are responsible for people risk across the EMEA region. It's been a great group to meet with, and typically in the past we have hosted in-person events, usually over breakfast or drinks where we have topics and speakers. However, over the past 8 weeks, we have embraced this new working normal and brought all of our events online. This is the second digital coffee event that we have hosted so far. The topics that we share are driven by our network members, so we really appreciate your feedback, and today's agenda has been put together to reflect the feedback from our last event 4 weeks ago. So just before we get started, everyone will have their video on. Unfortunately for me, I do not think I'm shown, which I'm a little bit disappointed because I got all myself all ready today to go on camera. But we do have a whole host of speakers today. We would encourage you to ask questions as we go through. You can ask questions in the web functionality on the webinar. We will pause after each session to answer the questions. However, if we don't get through all of them, we will certainly be taking a note. We have our question master today, who is Raul Milara, who will read out the questions as we go at the end. And finally, we just ask if you could please put yourself on mute to avoid any background noise. And of course, this session today is in English. I know we have a very international audience. If you would like to discuss with us afterwards or in another language, please do not hesitate to get in touch because we can accommodate. Okay, so we have 1 hour this morning, and we wanted to provide you an update on 3 different topics that we had been asked for following the last webinar. The first one will be on Spain. Spain has been one of the countries that has been most affected with Covid-19 alongside Italy. It has the largest number of cases in Europe, and many of you wanted to understand what companies are doing to get employees to return to work, and also the obligations of the employers when employees are working from home. The second update will be on the UK. The UK has also been impacted in a similar way, and a lot of you wanted to understand what companies were doing to tackle wellbeing at this time. And then finally, lots of people were asking, what have companies done in China to get employees back to work? Well, how can we learn from China when helping our organisations return as well? So we have a full agenda. So a quick introduction from our team today. Myself, Suzanne, nice to meet you all. We have Elia Cortez from Aon Spain. Elia works in our global benefits team. Charles Albert, who's Head of Health and Wellbeing for Aon UK, and Lucy Liu, who is Head of Aon China Health and Retirement. We also have our panel experts from our Growing Multinational Network. So if you have any specific questions that are not specific to our panel on global benefits, global mobility or retirement, please feel free to add these questions in as well. So just to set the scene a little bit, what has changed in the last 4 weeks since our last webinar? So there isn't really a day where we don't talk about COVID-19. Every call or WebEx, it seems to be the first topic of conversation with every colleague, client, person in my family. Yet for many of us, we are just adjusting to this everyday new life and routine. Yet the situation, of course, is still in the balance, and everyone wants to know when we can return to the new normal. Many people have died, and the virus continues to pose a threat, particularly to the elderly, people with conditions like ongoing conditions like diabetes, respiratory diseases, and heart conditions. Social distancing does seem to be paying off in many countries with fewer hospitalizations. However, the immense economic toll of the crisis carries huge health risks as well. Household financial stress also leads to increased substance abuse, domestic violence, and even suicide. Some governments are under increasing pressure from workers and businesses to end the lockdowns, and several European countries have already begun to reopen their economies, which we will talk about as we go through. Yet the thing that we don't know is the economic impacts yet, because many countries still do not have this virus under control. But what we do know is that we can change. It's how you can handle this in a consistent way that can also ultimately bring positive outcomes for countries, people, and your organisations. So at Aon, we have a global, consistent way to respond to crisis, as luckily we have a crisis management part of our business. It covers all risks from retirement and health, and it's structured in a way to help clients around different stages of the pandemic. In our previous webinar, we discussed that it's not a linear process with no start and end. All data points to this being COVID-19 being a crisis with severe disruption at the beginning, but also at the end. And there will also be different waves of it, waves 1, 2, 3, and 4. COVID-19 will continue to impact the population, our countries, our region, our world. And there will be different pockets of outbreaks expected to reoccur until a vaccine can be distributed. Part of this, we're helping with the react and the response phase. Specifically today, where Elia and Charles will talk about and give examples of what is happening in Spain and the UK. Lucy will take us through an example of China, how they are managing the recovery phase of that. And in the next couple of digital coffee mornings and webinars, we'll talk about the recover and reshape and how you can do this to build a resilient workforce as you go on. There's a wide variety of business needs, and we understand at Aon that there are many companies here today that have joined that are in different stages of their business continuity plan. And it depends on the industry sector and local economy as well. But this model here, that hopefully you can see in front with react, respond, recover and reshape, can support businesses of all stages in their business continuity planning. So as I said, last time we focused on the Nordics, we touched on Spain, but today we're going to talk about what this means for the response and recovery for Spain, the UK response and China's recovery. So on that note, I'm going to pass to my colleague Elia, who's going to give an update on Spain and what companies are doing at this time. Thank you, Elia.
Thank you, Suzanne. Hello, everyone. I would like to provide a quick update on the current situation at Spain. The curve started to stabilize and the number of deaths from COVID-19 dropped to its lowest level in over a month. However, number of infected is about 220,000. Spain is currently in the response phase and looking forward to recover. For giving you a little of background, the Spanish government declared the state of emergency last 16th of March, and Spain is under lockdown until then. In Spain has one of the strictest coronavirus restrictions in the world. People over 18 years old are allowing only to go outside under few exceptions, such supermarket or pharmacy. Apart from non-essential services, if possible, it is mandatory to work from home for all citizens. Last Sunday, children under 14 years old could go out of their homes for the first time since the lockdown began 7 weeks ago. From this Saturday on, we will be allowing to go for a small walk or exercise. Yesterday, the Prime Minister announced that Spain will slow and gradual end the lockdown starting the 4th of May. Spanish government has extended the preferential working from home for 2 more months, so companies now have started to develop the business continuity plan, return to work, and a plan to ensure the safety in the place work to their employees. In relation to the local benefits, life and business travel policies with Aon Contract Career Panel include and cover the pandemic, so the COVID-19 is included. On the health industry, public system is focused on COVID treatment, and they are only assisting on oncology and maternity issues. Some hotels and other spaces have been converted into hospitals to treat the coronavirus. The private sector is also covering the coronavirus. Telemedicine has highly increased the use in the past weeks as allowed to have video consultations from home. Open Health, the service provided at Aon Spain, has been upgraded, including psychology sessions. This is an upgrade on voluntary basis through phone calls or video consultancy for the large companies for the COVID-19. There had been some local coverage for the COVID-19 in case of hospitalization, which included a daily allowance. Also, there is a coverage available for death. Indemnity is paid as funeral expenses, so it is not necessary to provide any justification that the cause was provided by COVID-19. Medical team at Aon Spain is providing medical consultation services, inquiries relating to tests available, and guiding the companies now to which one they should use for the returning to work and helping them to prepare for the return to work. In Spain, there have been approved a temporary layoff. In Spain, this is named ERTE. There are two types of ERTE. One is the unemployment temporary up to 6 months. The state will provide to the employees the 70% of monthly earnings. And the second one is the reduction of working hours. In this case, the state pays the 70% and company complement the working hours. It's important to say that states pays directly to the employees. And in some cases, some companies are complementing the salaries, but this is not mandatory. Same for the benefits continuity. When employees are laid off, there is no obligation to maintain the benefits, but we highly recommend to our clients to maintain the continuity of the benefits provided, even if the companies are in temporary layoff, to support the employees. In some cases where employees are on temporary layoff and companies cannot afford to pay the benefits, some medical insurers have developed mirror temporary policies paid voluntarily by employees to maintain the medical coverage. Same for pension plans. Some companies are deferring contributions to the retirement system due to the market volatility. However, staff contributions is not extended. As the medical sector is covering the COVID, the insurance may find some delays on the appointments. Medical providers implemented assistant telephones and recommend to doing remote digital consultations instead of going to the hospitals and medical centers. Most of companies in Spain are taking care of the well-being policies and defining new strategies that reflect the well-being of the employees in a holistic manner. The resilience of any company and business relies in the resilience of its employees. That in the meantime relies on the 5 pillars: the physical, the social, professional, financial, and emotional. Social and physical well-being were a way of life in Spain before the COVID-19. This was something that is already part of the Spanish culture. Emotion and financial well-being were not topics that were discussed frequently at work or with your employer. So companies now recognize the importance of emotional well-being to support employees through this time. And we are seeing many Spanish companies introducing support such as meditation apps.
Okay.
So, yeah.
Thank you, Ilya. And I think that's really interesting to say, particularly from my perspective, that well-being has, of course, changed in Spain as well. Just quickly here, we'll just take a quick pause and turn to our question master, Raul, just to see if we've got any questions come through on this topic. Raul, do we have any questions?
Yeah, we have a question regarding telemedicine. It is
Okay.
What is the cost of telemedicine in Spain?
Telemedicine in Spain, it has a fixed cost per employee, which is €3 per month. The service has been upgraded, including psychology sessions through phone calls, which is €3 plus per month, are video consultancies of €4 for the large companies.
Thank you very much.
Any other, Raul, or before we move on to the next one?
Yes, we have another one. Who is currently providing COVID-19 testing? Public health system only?
No, the public and private. There are private test selling that there are very different types, and Aon is helping the companies to understand which is the best or the best that can suit better their needs, and also they are providing support and guidance in which one will adapt better to the company, and also put in contact with the providers. that provide these services.
Okay, and
I think
the
that's
last one, oh, sorry.
On you go, Raul.
The last question we have is what are companies doing in Spain for health and safety? I understand companies need to legally provide other occupational health requirements when they are working from home.
Okay, you have to comply with rules for working from home, some basics, such as having a suitable, adapted, and a comfortable place to work with a screen and these things. But in these situations that employees are not used to work from home, they are finding some issues such as back pain and other issues in employees. So now the companies have started to provide tips to the employees or some sample exercise to avoid this kind of issues. And the company's health and safety departments are very focused on controlling the contagion, how they are going to disinfect the workplace, and also in addition to the protocols to returning to work, the equipment. So now they are very focused on develop the new strategy.
Thank you, Elia.
Okay.
That's all for the
Thank
moment.
you, Raul. Thank you, Elia. I think just on the question of testing, there are 3 different types of testing on COVID-19 available in Spain, and we have a document that we can send after this if you'd like to learn, which explains the different impacts and the types of testing. So that's very relevant all on the part of Wellbeing. We're now going to pass to Charles Albert, who is Head of Health and Wellbeing for Aon in the UK. And Charles is going to take us through some of the things that companies are facing there. Charles, over to you.
Thanks, Suzanne, and good morning, everyone. So first of all, in terms of where the UK is, so we're still very much in the react and respond phase of this global pandemic. Despite increasing pressure on the Prime Minister to start to relax some of the lockdown, we have no clear indication at this stage about what the future plan is. But I think the one thing that's relevant as we start to think about the next phases of this pandemic is that it's going to be with us for a long time. So even if we start to get indications that the lockdown will be relaxed, I think there will still very much be on a limited basis, and we're still going to see big numbers of employees working from home where they are able to. Now, the impact of COVID-19 has been quite wide-reaching because we have such a wide number of industries in the UK. So some organisations are working on skeleton staff, where the majority of employees have been furloughed, right through to the other side, where organisations are mostly able to work virtually and they're trying to continue with business as usual as far as they possibly can. Now, even before COVID-19, employers recognised the link between health and work productivity. But the lack of budget has been the biggest barrier to them making genuine change to the health and well-being of their employees. And whilst COVID-19 clearly has put health into very sharp focus, I'm really concerned that budgets in this situation is even more stretched than they were before. And the risk that we run is that we don't invest appropriately in employee health and well-being as we come out of this. So later on, I will share some early indications from a survey that shows just the impact that COVID-19 is starting to have on the health of the workforce. So now more than ever before, we have to think carefully about the impact on employees' mental health and their physical health, and what our response is going to be as we come out of the situation gradually. Now, I won't go through all of the impacts that you see on the screen in front of you, but let's recognize that people are impacted in a number of different ways. Most of us are feeling anxious about getting ill, which is absolutely normal for us to go through. People with caring responsibilities, we always had the challenge of the sandwich generation in the UK, where we have both children and elderly parents that we are responsible for. Obviously, with people needing to stay at home, potentially with parents, and definitely with children if you've got them. that really makes that far greater challenge than before. And loneliness has been a growing issue for us in our society. In the UK, over 9 million people feel lonely often or always. And this isn't an issue that just impacts the elderly. It can impact you at any age. And of course, social distancing, lockdown is only making that ever worse. And home working has been a big trend for us in the UK, but of course that's got various challenges to it, as we've seen with people struggling to balance work life, to switch off at the end of the day, to maintain a normal working day, and also to work in a way that is set up appropriately for their musculoskeletal health. Next slide, Suzanne, please. So I'd spoken about, thank you. I'd spoken about the anxiety that people are feeling about the virus and about getting ill. I think we also need to recognise there's a wide number of other emotions that people are feeling at this stage. People might be fearful, they might be feeling sad, they might feel grief for the things that they've lost that they can't have at the moment, or potentially the loss of a loved one. They might feel more stressed than before, and they might feel like they've generally got a low mood and a wide range of other emotions. We need to be conscious of this as employers and be flexible to recognize that people need additional support during the current time. We have the benefit of hindsight of the SARS epidemic in the early noughties. And a study that was conducted then on 15,000 people who were quarantined showed a large number of those being diagnosed with post-traumatic stress disorder, or PTSD, and depression, and they suffered with other challenges such as substance and alcohol dependency after that. To me, this is incredibly useful insight into the coronavirus pandemic and some of the things that we need to be thinking about now so that we can be resilient as we come out of it. Slide, please. From an employer perspective, all of the emotions that we've just been through and the situation that people are in clearly is going to have an impact on people's productivity and the way that they work. From our perspective, I think we'll see an increased number of errors and omissions, increased health and benefits cost, strained work relationships, and that's across the board. Colleagues, your boss, your clients. We might potentially see people making more health and safety mistakes, and that equally applies at home. And people just generally being distracted. So it's really important for us to recognise the impact on the workplace potentially. Next slide, please. Now, even before COVID-19, mental health issues was on the rise. As you can see here, common mental health conditions such as anxiety and depression has been increasing at an alarming rate over the last 20 or so years. Now, that trend's only expected to continue. The World Health Organization projects that depression will be the biggest disease in the world by the year 2030. So that's only 10 years from now, and that's without the impact of the current situation that we're in. On to the next slide. Thanks, Suzanne. So a really interesting survey that's being conducted in the UK at the moment amongst employees who are working from home is the impact of the current situation on their health and well-being. So thus far, over 500 people have responded to the survey, and it's giving us really interesting insight into what we suspect the impact might be, but actually in actual black and white numbers. We're seeing that people are reporting a significant increase in the number of musculoskeletal conditions. So whilst we're all working from home, people are suffering with neck, shoulder, and back pain, and that's more than half of people who are working from home at the moment. Many people are exercising less than they were before, moving around less than they were. Even something as simple as traveling to work by train means that you often are moving about and getting steps in. We know that people are drinking more and that they're eating less healthily because unhealthy snacks are within easy reach at home. I'm also worried about the fact that we're starting to see people's sleep being impacted, and we know just how important sleep is for our general health and well-being. People are showing increasing levels of fatigue, and we're also seeing irregular and longer working hours. So work-life balance is really out of kilter at the moment. And employees aren't happy with that. But half of employees have reported they're not happy with their current work-life balance, and they're feeling isolated as well. So turning that into some action for employers, what can we potentially do both in the current situation and as we come out of this? I think first of all, across all areas, awareness and education is really important. That's self-prevention. So the responsibility on the individual to do the right things themselves. But there's a lot more that employers can do. We're seeing increased take-up of remote workstation assessments. So that's where a physiotherapist or an ergonomist would video in to the employee's workspace and give them tips to look after their musculoskeletal health. We're also seeing increasing numbers of virtual exercise classes, either free online, but also provided by employers through health and wellbeing companies. So online yoga, high intensity interval training, stretching, Pilates. There's some fantastic examples of what people can do at home when they're unable to go to the gym. And we're also seeing an increased interest in sleep and meditation apps. So we're recognizing the impact the situation is having on people's mental health and on their physical health. And sleep and meditation apps are a really effective way on something that you can easily distribute across a global workforce. And this is a time when internal support structures are really important, whether that be line managers, wellbeing ambassadors, mental health first aiders, whatever structure you have in place. Keep an eye out for one another to monitor workloads and to make sure that people are able to manage what they've got on at the moment. One of the things that we've shared with our colleagues is a daily wellbeing checklist. So a 10-point checklist that people can use to check that they are looking after their health and well-being in their working day. This provides some structure to people, which is one of the key recommendations for us looking after our health during COVID-19. That includes guidance around trying to get up and go to bed at the same time each day, and the same for your work day as well. So try to start at the same time and finish at the same time. Whilst that's not always possible, certainly not for me, I dust myself off and start afresh the next day. And there are a number of other things on this list that people can tick to make sure that they're doing the right things during their working day. We're very happy to share this checklist with you after today's call. Next slide, please.
I think there's still a little lag.
That's fine, thanks. I know the Wi-Fi is slightly slow, isn't it? So just a couple of slides to close off. I think first of all, let's just remind ourselves why this is important. So we looked at the negative impact that this could potentially be having on the workplace. But from a positive perspective, as we build more resilient organizations with more resilient people in them, we see that people are more engaged with their jobs and deliver far greater productivity and profitability. And customers love working with organizations where employees are healthy as well. And just finally, looking at some of the services that we're delivering to clients during the current time. Fortunately, most of the things that we deliver are able to be delivered remotely, virtually. So things like employee assistance programs have really increased in popularity. EAPs were already the #1 employee benefit in the UK after pensions. But where some organisations don't have an EAP, particularly global organisations, we've seen a big uptake in inquiries and launching of EAP services as a response. We've seen greater health promotion, so virtual health and wellbeing presentations on a range of topics, from the importance of social connection during COVID-19 to looking after your mental health and well-being whilst working from home. We're also seeing a big increase in telemedicine, which we touched on slightly earlier on. But virtual GP services are incredibly valuable in the current time, particularly for a global workforce. And finally, because so many people are unfortunately impacted financially during this time, there's been a big increase in demand for our financial education and financial well-being workshops. So I think that's the end of my presentation. Thank you very much.
Thank you, Charles. That was great. I think just before we move on to the next one, just want to check with our question master Raul if we have any questions for Charles.
Yeah, we have some questions. First one is, do companies have to legally provide any well-being benefits to employees in the UK?
So both yes and no. Employers have a legal responsibility to look after the health and safety of their employees, and there's a general duty of care as well to protect workers' health in the workplace. So in the current situation, that extends to a number of areas. So as we're asking employees to work from home, it's important that we assess the risk of each person's situation and make sure that we provide as much support as we practically can. So yes, there is a responsibility on employers to look after the health and safety of employees, and in the current time, the shape of that's slightly different, but it's still there.
Next one, what are UK companies doing to support employees during COVID-19 mental health?
Okay. So there's a wide range of different things that organizations are doing in the UK at the current time. So first of all, making sure that you've got the right employee benefits in place. So I mentioned employee assistance program, a key benefit, but of course that doesn't cover all levels of mental health therapy that's required. Private medical insurance is really coming into its own, and most providers are now offering therapy via video, so you don't have to see a therapist in person. From a preventative perspective, we're seeing increasing communication with employees, both in terms of what's available to them from a benefit and in the public space. So we've got some great public guidance about looking after your mental health during COVID-19. And I'm seeing more and more employers using that to raise employees' awareness of what they can do in the current time. We're seeing an increase in virtual presentations around these topics, and also employers starting to talk about what can we do proactively to try and prevent issues in the first place. So we're seeing increasing inquiries around things like mindfulness apps, for instance, which is becoming really popular in the current time.
And regarding mental health, too, we have a last one. Who are the best providers to support mental health in the UK?
Well, there's a massive market actually from a mental health perspective, and from a technology perspective, many new providers are launched on a regular basis. So I would say please get in touch with us. Part of our roles is to help clients find the right providers that's appropriate for their particular requirements. And we also have pre-negotiated solutions, what we call structured portfolio solutions. So that's where we've conducted a market review and appointed a preferred provider. And we work with preferred providers across a wide range of different services, such as employee assistance programs and so on.
Thank you.
Okay, thanks, Raul. Thank you, Charles. If we do have any more questions coming through, as I said, we will keep track of these and we will put them all together at the end. I think that's led quite nicely, Charles, in from your part around wellbeing. As we now will hand over to Lucy Liu, who's Head of Health and Retirement for Aon China. Lucy is going to take us through what companies have been doing as part of the recovery phase and return to work. I hope you'll find it very interesting. I certainly have. I've said it a few times now, and I'm sure we'll have lots of questions against this one. Thank you. Lucy, over to you.
Yes. Thank you so much, Suzanne. And thanks, of course, I'm very happy to be here to share the China practices. Thanks for inviting me for today's discussion. I'm going to talk about things we have done during this very difficult and challenging period. On this slide, what you have seen is the well-being model Aon is using. And during this special period, we really encourage you to make sure to address your employees' well-being from all 5 aspects of the Aon well-being model, which means physical, emotional, financial, social, and career well-being. Next slide, please. Yeah, so this page really includes information of what needs to be done immediately after the pandemic broke out. So in China, most companies immediately kicked off their BCP plan when the breakout happened. First, what we have done is review the BCP plan and created and added new and necessary protocols related to the disease. I will cover on the special protocols in the next slide. And second important thing to do is really to prepare internal and external communication plan and provide adequate education sessions to employee. Because especially during the outbreak stage, there's a lot of misleading information flying around. It's very important to identify reliable source of information and to give employees the right amount and the correct information, and as well as keeping internal and external stakeholder informed of your own business and your measures taking care of the employees' health and well-being. So, to the core of the BCP plan is the core tree. And because of the development of social media, so in China, we have widely utilized the WeChat tree. So instead of doing the traditional way of call tree contacting people, so we have formed the WeChat groups. And so that, employers are really connecting with employees on the WeChat group and knowing everybody's whereabouts and health status through the new social media connection. And lastly, but not least, is really review the medical supply situation and secure, all the necessary protective gear that is needed, especially in view of returning your employees. So in China, as soon as the Wuhan lockdown was announced, most employer, immediately started to source for medical supplies like masks, like disinfectants, and those who reacted slowly, basically, got into difficult situation in sourcing as well as paying a much higher price. Making sure you do have enough medical supply stock before you really announce the full return of business. Okay, so for the special protocols that I mentioned, this is what we have done in China. Firstly, a daily reporting and the tracking protocol is very important. So for this daily reporting and the tracking, basically what we have done is hand out a long questionnaire for employee to fill out on a daily basis. Employee will report their own health status, their family members' health status who live with them, and their close contact history, whether they have close contact with people who travel to and from the infected area, and also their own travel record, etc. and etc. And this also needs to be updated. In the beginning, we collected information of contacting history with people travel from and to Hubei and Wuhan. And later on stage, we started collecting information of whether you have contact with people who returning from overseas. This is to make sure that you are really on top of people's health status. Disinfection protocol. This is very important, after you start to ask people to return. This is the protocol that really helps you sanitize your workplace. Right now, what we have been doing is in all public places, like the lift, like conference rooms, like a toilet, we sanitize on every hour basis. And we also have special quarantine room in each workplace. So if there's any employee feel uncomfortable or show symptoms, that employee can be immediately, moved to that, isolated room or quarantine place. So things like that needs to be placed before you can really ask people to return. Case management protocol refers to the policy of what you will do with people who are infected and people who have close contact with those people who are infected, the quarantine policy, and also refers to what will be the work arrangement for those people who have recovered, from the infection. Medical supply stock and distribution protocol, as I mentioned, that it is very important to have all the necessary protective gears at workplace to protect your employee. So basically in China, most companies will secure at least 1 month of stock of masks of disinfectants and before they arrange massive scale of return. And because a lot of business are operating on national basis, which means with different locations, so the distribution protocol also needs to be in place. Next slide, please. Yeah, this is, I think, this will be today's focus. I would like to talk about. So basically, we have gone through 3 distinctive stages returning to work, with the first stage being really work from home and quarantine at home. So which means that, as you can see, we announced the Wuhan lockdown on January 23rd. And immediately following that is the Chinese New Year. And there's a 7-day holiday for the Chinese New Year. So at that time, everybody stayed at home. But after the Chinese holiday, how to arrange the work becomes a question. And I still remember during that period, almost all clients were checking with each other when to return, how to reopen, things like that. But to be conservative, I think for the initial 3 weeks, most of the business decided that they will remain quarantine at home and work from home with very restricted returning to work. And that period is also the major outbreak period with sharply increasing cases happening. So I think I do understand that probably that's the stage that some countries are experiencing right now or just experienced. The second stage is what we call a phased return on stage. And that is the phase we start to see bending of the curve with flattening of cases and decreasing cases. And for this phase, some company, actually experienced the 2 phases, where others may have something in between. The first stage, the first substage is a small scale return with only 20 to 30% of people, very business essential people returning to work. And even for this small number, typically company will ask people to only stay in office briefly, the business task conducted and then leave. So it's rarely you ask people to stay there all the time. And so the business essential refers to HR people, finance, IT, business leaders, because you need to have something done, right? So that is probably lasted for 2 or 3 weeks. And when we started to see the curve is really bent and it starts to be decreasing, then we encourage people to go back and most companies have 2 shifts, so they ask 50% people to return to office. And the third stage is 100% return. That is starting March 16th. I still remember on March 13th, for a case, Aon CEO announced all of Aon starting working from home. And in China, we announced everybody returns to office. And we have been returning to office for a full month now. And since seems to be okay. By looking back, I think it's really the panic during the initial stage that is really worrisome. But you have really gone through all of these things. Looking back, I think that all of these things can be very, very well managed. And after so many businesses returned, I think most businesses are doing well. At least I didn't hear any of our clients having reported cluster cases after return. Okay, so I won't read through everything on this page, but very importantly, I think what we have done is that we basically identify employee type by the potential risk through tracking health records. So in principle, companies can and ask their employees gradually return to work, starting from the low risk level employees. For example, in Shanghai, the low risk level employees are people who stayed in Shanghai since the Chinese New Year. They didn't have close contact with people travel from infected areas. Those are viewed as the low risk staff. Medium risk is people who return from outside of Shanghai. For those people, they need to quarantine 14 days before they can return. And for high-risk people, obviously, for example, currently the Wuhan lockdown has been lifted since April the 8th, and a lot of people are returning from Wuhan or Hubei. And these people, before they can go to work, they need to take the test, and they need to take the test and then fulfill a quarantine period before they can return. So you really need to categorize employee according to their health record and other information. And in China, every employee is assigned a health code by the public health official, which can be easily identified on their mobile phone. And business building only allow employees with a green code to enter the office. And next page, please. And the next few pages, I'm going to talk about what employers have done, especially to take care of employees' well-being from benefits on physical well-being and mental well-being perspective. With regard to benefits offered during the outbreak, I think most employers offered flexible working arrangement, flex working hours. For example, Aon China, we actually allow employees to come to work with the flexibility between 8 a.m. to 11 a.m. So employee can pick time slots. I mean, this will help employee avoid the peak commuting hours. Because we really want employee to protect themselves if they are using public transportation. And the second most popular, excuse me, the second most popular benefits is EAP. So it could be rolling out a new EAP program or just offer EAP related assistance like stress management seminar, health protection training, and COVID-19 related, health education. I think are offered by most employers. And thirdly is offer additional insurance coverage to cover employees' COVID-19 risks. In China, if employee pays for the social medical, the COVID-19 expenses are fully paid by the government, and the commercial medical insurance also covers the COVID-19, treatment costs. But still, the employers purchase the additional life cover and the additional medical allowance cover, to show their caring for employees. Next page, please. Yeah, I mean, this page really shows that, the emotional well-being that is being taken care by employers in China. The data is provided by a EAP provider, which shows that majority employees' mental state is being affected. But I must admit that this only happens during the initial period of the outbreak of the sharply increased cases. I think currently the mental health issue is less of a concern. But what I think the special actions have taken really helped ease employees' anxiety and their mental issues. You can see besides the hotline services, there's a lot of health support, online training has been provided. For example, before Aon China, before we announced the 100% return to office, we arranged a special online, health talk. We invited a local health expert, and she really addressed all the questions raised by employee. and even including some stupid questions. And with that being offered, employee feel like, okay, they feel like happy and safe to go back to work. So I think that before companies really reopen the business and ask people to massively come back to work, really make sure you offer the online training and the education. So taking care of employees' physical well-being, there's a lot of things that we have done. For example, in China, we do ask employees to wear masks during their public transportation, and we even ask the employees to wear masks at work. For example, I'm wearing a mask now because I'm using the conference room. I'm in a public area, so I to protect myself and also others. So I'm following the company procedure. And temperature taking is everywhere. You enter into office building, restaurant, and temperature is being checked. And during the initial stage, to be honest, most office buildings air condition system did not open. So you can imagine during in February, Shanghai was very cold without air conditioning. So employees, but some companies provide blankets, provided other support. These were the procedure that were taken at the initial stage when few people returned, and at that time, there people were still uncertain of, the development. So the precautions measure were really taken. Even after we are returning full months for meetings, we still encourage people to do online meeting rather than gathering together in a conference room. And for each conference room, we limit the number of people can go in and can have, so that making sure there's a social distancing. Lunch is also a talking point because we discourage people of having a gathering, during lunch. Basically, each employee is to have lunch at their own desk, and if they choose to have lunch at cafeteria, they need to sit apart, and we ask them not to talk during the lunch hour. And travel, there's still very stringent restrictions on travel, and it also depends on the area that you have traveled to. There's a requirement on quarantine. So these are the things that companies have taken for taking care of employees' physical well-being. With the limited time, I think I can only share about, but I would like to recommend the top 3 important to-dos. Firstly, it's important, daily reporting and tracking. This is to really make sure you're on top of your employees' health information, and to help you arrange who can return, during the first stage, and how you gradually return people. And secondly, social distancing and wearing masks. This is very, very important, especially when there are still reported cases. We do have cases, in mid of February when they returned because they didn't observe social distancing, because people didn't wear masks. There were cluster of cases happening in some companies, and the business was shut down immediately. And employee education and communication is so critical, so important. And how your employee well-being is impacted, I think is really can be managed if you provide the necessary communication and support, and also all the necessary online training. It's most likely that your employee will remain calm and rational, and they will return to work peacefully. Those companies that didn't do this, probably they will still suffer, some employmental issues. I think with the limited time, that will be my today's sharing. I hope it will be very helpful to you online.
Thank you very much, Lucy. I think that was very interesting, I think, for most people that are still in quarantine stage. I'll just quickly ask a question master, Raul, again, if we've got any questions for you, Lucy. If you still, we've got another few minutes, it'd be great to cover some of those.
Yeah, sure. We have some questions. How do you decide who returns to work in China?
Yeah, like I said, you really return those people with the lowest risk of health risks, right? And during the initial stage, you only return the business essential people and the people who have private transportation. So that's the rule we have adopted. So we only have people who return that if they have private cars. And because during the first phase of return, we have avoided using public transportation. We only allow walking, bicycle, and private car. So those people who use public transportation basically still work from home.
Okay, next one. What happens if you return to work and someone becomes unwell at the office?
If someone becomes unwell in the office, firstly, because of the temperature taking procedure, we typically, if people who run the high fever cannot be admitted into the building. But if somebody becomes unwell or have symptoms during work, one of the BCP procedure of case management is to immediately evacuate this person to a quarantine room and also contact the health official and to do the necessary, evaluation. And of course, there are cases may not be COVID-19 related, unwellness. Could be, just some other reasons. And after the assessment, if this person needs to be isolated or quarantined and it's COVID-19 related, then the public health system will take over.
Okay. And now we have some questions regarding mask. So I will make like a summary. The main concern of the viewers are how many masks do you need per employee? Since you mentioned that companies require a minimum of 1 month supplies for the office, how often do you require to replace the mask?
Yeah, that's a good question. So I think this is very important. In China, basically, companies, during the early breakout period, we were also having difficulty buying masks. And later on, the manufacturing really resumed. So things got better. It's really recommending that you have 1 month stock, one person, 1 day. It also depends on, whether you return to office 100% skill or you just return on partial skill. But the mask stock really goes with your return to work plan. But it's best to prepare at least 1 month stock of masks before you announce the full return. And we are asked to wear a mask during work, especially when talking to each other, because the virus is transmitting through droplets. And there will be people who are infected with no symptoms. So wearing mask is the best means to protect the workforce.
Okay, perfect. Thank you very much. And now we have some questions that are general. But first of all, just in case that someone cannot continue in the call, there's many questions about if we are going to share the presentation and the recorded session, and we will share it with everyone who attend the meeting. So now I have a question for Charles. I'm worried about supporting employees while is on furlough, given they should not be working at this time. Do you have any best practice examples of supporting them other than keeping in regular contact?
Yes, so I mean that's a really good question, because it is really important that we look after employees on furlough. I think so. Regular communication, I know, other than really important. So I think not losing touch with those employees, still making them feel part of the organisation, I think is important, so that you're thinking about them. I think the other part is think about health and well-being at home and the things that you can do. So they're not working, they're not necessarily at a desk, so that's not such a big issue. But keeping active whilst at home, still eating a healthy diet, managing your alcohol consumption, all of that stuff's really important. And there's so many things that employers can do, so many options out there to support them. And then I'd say lastly, think about guidance and tips about how to make the most of this time that you've now got on your hands. There are so many, there are thousands of free university courses being offered online at the moment, which is fantastic. So it's such a great opportunity to raise awareness of kind of education during this time, and get people to potentially do some courses as well.
Thank you. And we have a general one, so whoever wants to ask it, answer it first can go ahead. Is there an expectation for employers to have health and safety insurance as they would for the office?
I think I can maybe take that one. Well, I think what we can say from that point, you obviously do have the general insurances that you would already have in place legally for employees who are working at the offices. And then you, in most instances, you legally have to provide this in case there's any accidents at work. And what we do see now as a supplementary, particularly for key workers, is critical care protection. So, I mean, not necessarily key workers, but anyone that's working in delivery, supermarkets, hospitals, any government jobs that must continue and you cannot do it from your home. We do see an increase in critical protection cover. And what that means is if someone falls ill due to coronavirus, they can have a payment or they're financially protected for that time.
Thank you, Susan. Another one, general, has childcare support been a big topic?
I think maybe I'll start this and then Charles, maybe if you want to just add a little bit on like elder care and things. Childcare support, I think definitely has been a topic. Specifically, I've seen a lot of it. A lot of questions have been asked around the US. It's definitely not something that's been raised. Of course, the biggest challenge has how can you provide childcare where there are restrictions of who you can actually come into contact with, without your home, or who can actually look after the children. A lot of these childcare organisations have in fact been shut down during this time, so it's almost become a challenge of you can't actually access it.
Suzanne. So for what we have done in China is when we determine who to return, the family situation is taken into consideration. For example, people who have younger kids at home, people who are pregnant, people who are having some medical conditions, those are the people we ask them to stay at home. And do realize that because currently in China, schools on a partial scale of reopening, only the graduating grade has been opened. So there are still people staying at home with their kids. So that needs to be considered.
Okay. Perfect. And next one, they are also asking for you, Lucy, if Aon China is making tests to the employees.
Is Aon China what? Sorry.
If they are testing the employees.
Testing the employees?
Yes.
Oh, yeah. So right now, any company can, freely test your employees, and any individual can also freely test your individual if you want. But we have not tested our employees. We have asked our employees to freely test themselves if they want to. There's a few things I think you need to consider, because in China, if any individual is tested positive, it's confirmed the case, and the business will be shut down. So currently, we have 100% people return to work. If a company initiates this, and we do run the risk, if anyone is, then the business will be immediately shut down. But people, there will be some requirements that, for example, if you travel to certain places or if you want to stay in a hotel, you need to show your test results. Basically, it's a company by company decision. And from my knowledge, currently most companies proactively test their Hubei and Wuhan employees or people who were stranded in Hubei and Wuhan. And now because of the lifting of the lockdown, people return. So people, actually company only test those people. But for people who basically just quarantine during the period, most companies choose not to proactively test them.
Thank you very much for the answer.
Okay, thank you as well.
I don't know if we have any more time because we're getting many questions now, Susan. So
yeah, I mean, we can stay on as long as everyone's okay to stay on for a few more minutes. Gabriella, are we okay to stay on for a few more minutes?
Yes, we can continue.
okay, perfect.
Yeah, okay. So we'll answer our next few questions. I'm conscious of time for everyone. Don't want to. There will be a recording of this, as Raoul said. So we'll continue for now, and hopefully we can answer as many as we can. If we miss any, we will come back to you.
We're having also many questions regarding GDPR in Europe and in the UK. They are asking, what about Europe and UK and data privacy regulation? Is someone on the panel in Europe able to answer? So on how are companies managing testing employees before return to work in terms of GDPR?
I can start this one. I think that's a really big question and certainly something that I ask myself, particularly in countries where it's already very difficult for employers to get access to medical data. Again, with any situation like this, it is voluntary, where employees declare personal information to their employees. We probably need to just check and look into that. Employees would voluntarily have to tell you about their personal situation. Charles, from the UK's perspective, do you have any view on that?
I think from the UK perspective, that's a bit of a challenging question just because of where we are in the pandemic. So any testing is really being focused on our key workers, our health workers, and that's where the resources are being focused. Of course, I'm expecting more private testing to be available as we progress. There is also some question about the reliability of some of the tests. So private occupational organisations have been asked to withhold any proactive testing until such time as the technology has been resolved. In the meantime, there are different types of tests that we see employers offering. For instance, telephonic assessments with an occupational health doctor who will tell you what the risk is of someone if they contract COVID-19. So that's back to Lucy's point about, who can and can't return to the workplace and what the potential impact would be on them. And then also return to work tests. So these are short 15-minute consultations to see whether the individual is actually ready to come back to work after they've contracted the virus. I'm getting a lot of inquiries from companies about testing, not as yet in a position to offer tests to their employees.
Perfect. Thank you. Another one regarding meditation apps. Are these being paid for fully by the employer, or are employees covering part of the cost? Are these being rolled out globally or locally?
So I'll just quickly respond to that because I think I raised the point about meditation apps. Previously, we've seen a mix of organizations either having the employee pay fully for the app themselves at a discount, part subsidizing, or some organizations pay for the app for all employees. Now the trend has been during COVID-19, we want something that's quick, easy, and effective to support people. So mindfulness apps tend to be rolled out on an employer-funded basis. The cost is actually quite a lot lower if you pay for your whole organization, so the per head cost. not the total cost, versus if you only part subsidize. So commercially, it actually, for some of my clients, has worked out cheaper to pay for everyone versus paying half of the cost for some employees, if that makes sense. And it is being looked at as a global solution. So I've got a number of examples of organizations where it might have been offered in the UK before. Now they're saying all employees around the world on a company funded basis to the end of the year.
Thank you, Charles. We have another one now for Lucy. What was done for people who were medically vulnerable but is essential roles?
I think that's a very good question. So like I mentioned, we do categorize people according to their health status. So if people who are business essential but vulnerable, so these people, we recommend them to work from home. And also because business essential really means business essential tasks, right? So and most business, they do have backup roles, so we don't have to ask people who are vulnerable to return to work before we knowing whether it's safe for them to return. So it's recommending that the backup role fill in their job.
Thank you, Lucy. And we have a couple more questions. UK medical insurance has been impacted with the NHS taking over many beds. How do you address employees' concerns that they are not getting full value of their premiums during this time?
That's a very good question, and a very real issue actually that people are raising, particularly in the current time where potentially salaries might have been reduced, or people are financially impacted, if not themselves, maybe their partner is impacted. So we also always need to think broadly that it's not just the individual, but that those are around them. We are starting to see more discussion about things like insurance premium holidays as potentials. Different insurers are responding in different ways. We recognize that people can't necessarily access their full benefits at this stage, but there's still a lot of benefits in private medical insurance. I've mentioned you can access physiotherapy or mental health therapy virtually as well. I would say reach out to your employee benefit consultant and have a discussion about what your insurer's view in particular is. I would caution against allowing employees to opt out of private healthcare at this stage. There are many implications for doing that, and you need to think those through carefully before you take any action. So speak to your employee benefits consultant for advice.
Thank you, Charles. And last question for now, but if you have any more questions later on, you can always contact all the people who has been on this meeting, Susan, Charles, Lucy, Elia. So the last one is for Lucy. Can you, sorry, if they have created a specific plan for stores and retail market in China? Have you created a specific plan for stores and retail market in China?
Sorry, hello?
Yeah. Have you created a specific plan for stores and retail market in China?
For stars? Sorry, it's not very clear. The connection was bad.
I think
sorry.
what Raoul was saying, Lucy, is there a specific plan for stores or retail industries in China to return to work? Is there any specific plans?
Oh, okay.
To return.
Okay, stores and the retail. Okay. Yeah. I think most stores have reopened, and I think it's just like reflecting what have been said. And the disinfection product was very important. How to sanitize, and for example, Starbucks reopened, but people are not allowed to sit. They can buy coffee and leave, But typically, if you do stay, you really to have to sit with social distancing. And most retail have reopened. I think what we have still remain closed is the theaters. Movie theaters are still closed. And what else? Probably that's the only service I think is closed. So those business with very airtight environment are still not open, like theaters. But as long as you have open window and you have good and sound like ventilation air system, you can reopen. But with very strict sanitizing policy and disinfection protocol in place.
Okay, thank you, Raoul. Thanks, Lucy, Charles, and Elia. I think for now that's all of the questions that we've got time for just now today. Really appreciate everyone's time to get this. We will gather all the questions and we'll put together some answers, and we will then redistribute this across to everyone that attended. Just want to finish up here just now on some actions that you might want to consider going forward. Of course, it's about understanding the potential impact of your organisation to maintain operational through the recovery phase, but also make sure that employees have the right support in doing that. So physical, emotional well-being, so that is that supporting the families, childcare where possible, or even just keeping them fit, active and healthy. But most importantly, communicating with employees to make them feel engaged, but also understand what are the clear next steps. In this time of uncertainty, that is more important than ever. We've heard a lot of feedback from a lot of organisations, and one of the most impactful and important is the authenticity, I guess, of the communication. So many organisations, the CEOs are doing almost their own videos to communicate with employees, and the feedback and the things that I've spoken to many different companies, that has been powerful. But one of the things that you can do as an employer, particularly around the benefits, the well-being, to make sure that your benefits package is sustainable going forward. We understand many companies are reducing salaries, some are putting employees on furlough, and some are coming back to work. Understanding what the impact is and using the data that you have for your employee data, HR data, and compiling this together to map out what this would look like in future. So just to end here today, thank you to all of our speakers, to Elia, Charles, Lucy, Raoul, and also a big thanks to Gabriela from Aon Spain, who helped us put this together, for your time, and all the attendees who came and joined. We hope you found it interesting and useful. We really appreciate, as I said, we're now doing this on a monthly basis over a webinar with different topics. Our next event will be on the 27th of May, and we're going to be looking at how you can take different parts of your data and then predict the COVID-19 impact with our head of data analytics for EMEA, and we'll also have an update on Ireland as well. As I said again, we'll send out a feedback email. We'd love to hear from you if you've got any questions at all. We also have a group on LinkedIn where you feel free to connect. We upload all of our legislative updates and bulletins. If you want to register for our monthly updates, you can also receive that. And please let us know. You can get it in an email format. Really appreciate you coming today, and we look forward to speaking with you and hopefully joining us next month again. So thank you, everybody, and we will hopefully speak to you and see you soon.
Thank you.
Thank you, Stena.
Thank you.
Thank you. Bye-bye.
Bye-bye.